What if your body has been sending you signals about developing diabetes for a long time, and you've been ignoring them day after day? Even before any blood tests or an official diagnosis, the telltale signs of the disease can appear right on your feet. The information I'm sharing today could forever change the way you think about your health. Most people believe that diabetes can only be diagnosed through lab testing. You go to the doctor, get your blood drawn, get the results, and only then do you learn the truth. I understand why this belief holds. For years, my patients have told me the same thing. My name is Dr. Smile, and I've been practicing medicine for over 20 years. During that time, I've learned an important lesson that's reaffirmed in my office every week. Your body begins warning you of elevated blood sugar long before your test results show it. And the very first place these warning signs appear is in your feet. I decided to record this video because I've seen too many patients come to my office, or worse, end up in the emergency room with all the warning signs for months or even years, but simply not understanding what they were looking at. Today, I'll help you figure it all out. Just last month, I had a patient, a 67-year-old retired man. He was leading a healthy lifestyle and felt fine when he came in for just a routine checkup. However, before sending him for blood work, I asked him about the condition of his feet. He admitted to having some slight numbness for some time, but attributed it to his age. He had 4 of the 9 signs I'll share with you today. His fasting blood sugar was 214. He had been diabetic for over 2 years without even knowing it. Today, I want to show you exactly what I showed that patient. There are 9 signs that are already visible on millions of feet, but almost no one recognizes their true meaning. For each symptom, I'll explain what people commonly believe it to be, what's actually happening inside your body, and suggest one simple daily habit for protection. According to the American Diabetes Association, 1 in 5 Americans with diabetes doesn't even know they have the condition. That's more than 8 million people living with a silent disease that gradually destroys their nerves, kidneys, vision, and, of course, feet. The good news is that a blood test that costs just $12 can detect the problem early. But first, you need to know what to look for. So let's get started. Sign number 1 is something almost every patient has experienced, and everyone has an excuse for it. Tingling, numbness, a pins and needles sensation in the feet. My patients usually say, "Dr. Ben, my leg just goes numb sometimes when I sit cross-legged." Of course, everyone experiences this occasionally. But I always ask, does this happen regularly and for no apparent reason? If the answer is yes, we need to have a serious discussion about what's going on. Frequent, recurring numbness or tingling in the feet, which doctors call peripheral neuropathy, is one of the earliest indicators that your blood sugar has been elevated for a long time. Excess glucose in the bloodstream begins to break down the outer protective sheath of your nerves. It's a slow process, which is why most people don't notice it. I often give my patients this analogy. Imagine your nerves as electrical wires. Each wire has a plastic coating. This coating allows the signal to travel smoothly from your brain to your foot. When blood sugar stays high, it acts like an acid, slowly eating away at this coating. The wire still functions for a while, but the signals become unclear. And this unclear signal manifests as that tingling sensation. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It's the most common complication, and it almost always starts in the feet. That means tens of millions of people are experiencing that tingling sensation right now and dismissing it as nothing. Don't make their mistake. My daily recommendation for every patient over 60 is to walk for 20 or 30 minutes every day. Not running, but walking. Movement is the best way to maintain blood flow in your legs and protect your nerve endings. And start cutting back on added sugars today. Not next month, but today. My patients call symptom number 2 the most distressing because it doesn't bother them during the day. It appears at night, when a person is alone and trying to sleep and nothing can distract them. Many attribute it to tired feet after a day at work, summer heat, or simply overwork. Sometimes this is true, but when a patient says their feet feel like they're burning, especially at night when lying down, I take it extremely seriously. A burning sensation in the soles of your feet, especially at night, is a classic early symptom of diabetic neuropathy. What happens is that the nerves in your feet are damaged by excess sugar and are now sending false signals to your brain. Your brain receives a message about a high temperature, even though nothing hot is touching your foot. The nerves are malfunctioning. Imagine a fire alarm with a faulty sensor. The building isn't on fire, but the siren still sounds because the sensor is damaged. Your nervous system behaves exactly the same way. The burning sensation isn't coming from the outside, but from within. Damaged nerve tissue is crying out for help. A study published in the journal Diabetes Care found that burning pain in the legs is one of the first symptoms reported by patients later diagnosed with type 2 diabetes. It often manifests 1 to 3 years before doctors officially diagnose it. To combat this, I recommend 2 habits. First, drink at least 8 glasses of water a day. Proper hydration helps the kidneys eliminate excess glucose and supports nerve tissue. Second, add more fiber to every meal: vegetables, legumes, and oats. Fiber slows the absorption of sugar into the blood, which is vital for damaged nerves. Sign number 3 demands your utmost attention, as this is where discomfort gives way to real danger. This is the symptom that most often brings patients to the emergency room. They come in and say, "Dr. Ben, I got a small blister on my shoe 3 weeks ago, and it still hasn't healed." They waited, thinking the wound would heal on its own. Most minor injuries do heal on their own, but not with high blood sugar. When blood sugar is chronically high, the body loses its ability to effectively repair itself. Blood vessels throughout the body, including the tiny capillaries in the feet, begin to narrow and lose elasticity. This means that oxygen, white blood cells, and nutrients needed for tissue repair simply can't reach the wound quickly enough. The wound remains open, vulnerable, and heals extremely slowly. Imagine trying to water a garden with a hose that's severely kinked. The water flows, but it doesn't reach its target. This is how high blood sugar affects circulation in your feet. All the necessary healing factors are present in the blood, but they can't reach the injured area. An open wound that doesn't heal is a recipe for infection. According to the Centers for Disease Control and Prevention, diabetic foot ulcers are the leading cause of non-traumatic lower extremity amputations in the United States, more than 100,000 cases annually. And almost all of them are preceded by a small, ignored wound. Tonight, after a bath or shower, sit down and carefully examine both feet. Check between your toes and your heels. If you notice any cuts, calluses, or broken skin, wash the area with mild soap and water, apply antiseptic, and cover with a bandage. If your condition doesn't improve within 48 hours, see a doctor immediately. Not in a week, but in 48 hours. Sign number 4 is often hidden in plain sight. Most people experience it daily without realizing it. It's noticeable, it's been present for a long time, but almost no one connects it to their blood sugar levels. Patients notice their feet are getting darker or taking on a reddish tint and tell me, "I think it's just sun exposure," or "I've always had dark skin on my ankles." That may be true, but there's a specific pattern of color change, especially around the ankles, that I look for when assessing diabetes risk. When circulation is compromised due to high blood sugar, the legs and feet don't receive enough fresh, oxygenated blood. As a result, the skin changes color. You may notice a darkening, deep red, or even bluish tint around the ankles. This is your skin's way of telling you that blood flow to that area is insufficient. Some patients also experience thinner, more fragile skin in these areas. This is another sign that the tissues aren't getting the nutrition they need. I always explain it to my patients this way. Imagine your blood is a delivery truck carrying oxygen and nutrients. Your feet are at the very end of the longest route in your body, farther from your heart than any other part. When the roads narrow due to damaged blood vessels, the deliveries stop arriving on time. Skin deprived of fresh oxygen changes color. This is a distress signal you can see with your own eyes if you know what to look for. A study published in the Journal of the American Academy of Dermatology found that such skin changes appear on average 18 months before an official diabetes diagnosis. Your daily habit here is 5 minutes of foot rotations, toe raises, and calf stretches every morning. Even this small range of motion gets the blood flowing to your feet. If you can't exercise, even slightly elevating your legs while sitting can have significant benefits. If you found this video helpful, please share it. Send it to someone you care about, a family member, friend, or neighbor. You might just give them something they needed without even realizing it. I publish new videos every week. We discuss topics that are truly important for health after 60. These are the kinds of things I talk about with my patients that most people never hear outside the doctor's office. Subscribe and invite your loved ones. I am Dr. Smide. Take care of yourself, be proactive, and take care of your feet. See you in the next video. Thank you.